OsteoSignal episode 23. This is OsteoSignal with Neil D. O'Neill, a podcast exploring how your body's natural design connects with osteopathic science, translating complex signals into practical insights so you can truly thrive.
Welcome to the OsteoSignal podcast. This podcast is about understanding how the body actually heals, how structure, physiology, and signaling systems work together to determine whether a person is struggling with disease, merely surviving, or truly thriving. My name is Neil O'Neill. I'm a clinical osteopathic manual therapist and physical therapist. My work focuses on translating complex physiology, such as neuroendocrine signaling, biomechanics, immune regulation, and nervous system function into hands-on clinical methods that help restore adaptive capacity in patients. Much of my perspective comes from years of clinical practice combined with training in translational research, where the goal is to bridge the gap between the laboratory science and what actually helps people recover function in the clinic. Joining me today is Autumn Mayberry, a fellow osteopathic manual therapist whose work focuses on integrating structural treatment with the body's autonomic, endocrine, and visceral systems. Autumn brings a deep clinical perspective to these discussions and helps ground many of the concepts we talk about in real patient care. Hey, Autumn.
Hey, Neil, how's it going?
Doing well. And helping
Good.
guide the conversation is Brent Mayberry, our podcast facilitator. Brent is an engineer by training, which makes him the perfect person to ask the kinds of questions that many listeners are probably already thinking, helping translate some of the deeper physiological concepts into language that is clear, practical, and understandable. Hey, Brent. Thanks for being here.
Hey, Neil. Yeah, good to be on with you again.
Perfect. So today, our goal with the OsteoSignal podcast is simple: to explore the signals that regulate human health and to discuss how osteopathic manual therapy can support the body's ability to adapt, regulate, and recover. And in today's episode, we're talking about something that is often overlooked but incredibly important for both health and athletic performance: iron regulation. Specifically, we're looking at ferritin and transferrin. And these are not just lab values. These are part of a system that determines how well your body can produce energy, recover, and perform under stress. So why iron matters maybe more than you might think. Iron plays a central role in oxygen transport, energy production, muscle performance, and brain function. And we have patients coming in all the time. I have a brain fog. I'm not, my muscle's not recovering. I'm not getting the production that I want. I feel tired at the end of the day. I'm running out of energy by the end of the day. Some people complain of shortness of breath. Oftentimes that's not what people say, but they just say like, by 3:00, I'm just completely, tired. I feel like
Wiped out.
Yeah, I'm totally wiped out. I got to go get some caffeine, or I just can't make it through the day, or my neck and shoulders just start aching. That's when my headache comes on, et cetera, et cetera. So, and what that really is revealing to us is that person just doesn't have the energy to get through the day. And iron levels are a big part of that.
I can relate, so this is going to be good.
Yeah, this is for all of us, right? Okay,
Yeah.
So without adequate iron, your muscles fatigue faster, your endurance drops, and your recovery slows. Your brain function declines, right? And so in Alzheimer's, we say that we call that sundowners. But I think in all of us, we can kind of see that towards the end of the day, you're just flagging. You're not quite as quick on everything as you had been. And we want to have some insight into what might cause that and then what osteopathic manual therapy can do about that. So importantly, you can have normal hemoglobin and still have poor iron function. And that's really a problem, because a lot of times we just, you go to the doctor and say, oh, there's something wrong maybe. And the doctor does some simple blood tests and goes, no, everything looks good. And you're like, oh yeah, great. And again, I think this is one reason so many patients end up on hormone replacement therapies. They're going, well, I just don't have the energy. It's got to be the hormones. And that's a very, there's a lot going on when you do something with the hormones, and especially if, it just is about your red blood cell or your iron levels. And so let's get into, that's where ferritin and transferrin really come in. Let's see what they're all about. So ferritin, your iron storage. Ferritin is your body's iron reserve tank. It tells us how much iron you have stored and available. Kind of think of it like a savings account, right? If the ferritin is low, you have limited reserve. your performance drops under stress, and recovery becomes difficult, right? So especially in like, your kids are going to school, it's the end of the year, stuff, having to get ready for this and get ready for that. You're going to leave on vacation right after, and you're just worn out before you even leave on the trip. It's those sort of things where you're getting challenge after challenge after challenge, and then you just kind of fall apart. And so that's what we're talking about. It's like, well, that's not totally abnormal to be tired, but to just be laid out. And we do have patients come in just saying, man, I can't, I don't even feel like I have the energy to go on vacation. So common signs of low ferritin: fatigue, especially with exercise, reduced endurance, shortness of breath, poor recovery, hair loss or brittle nails, and decreased training capacity. That person just doesn't want to go. You don't feel like, I want to go to I have these goals of going to the gym. I want to go to the gym, but when it comes down to it, I'm just too tired to leave and go to the gym.
Hey Neil,
So-
I was just gonna ask you real quick. How does ferritin relate to hemoglobin? What's the connection there?
Well, okay. So the connection is that ferritin is a protein that binds to and stores iron inside your cells. Okay. So hemoglobin would be one place that occurs. So the ferritin is in your hemoglobin, all right? It's a crucial protein that stores iron inside your cells. Hemoglobin is a slightly different protein, right? So your red blood cells have ferritin in them, but they really are more hemoglobin that uses iron to transport oxygen. So in hemoglobin is a binding molecule that it's a rapid version. Let's put it that way. Hemoglobin is a rapid version of it, attaches to iron and then lets it off as you go through an area of low oxygenation, right? So that's one of the ways the pH of the area, the oxygenation of the area tells the red blood cell, the hemoglobin, there's actually a chemical reaction that the hemoglobin releases that oxygen there. Ferritin's a different structure. It's a protein that is a longer term binding of the iron. And it's a little bit more difficult to get it to come free of that, mainly because it's for two reasons, really. One reason is a safety. If you have too much iron in your body, actually is a health crisis that will cause all sorts of problems. You can't have free iron floating around. It will disrupt other bodily processes. Second off, bacteria make use of iron stores in your body to multiply, right? And so if you had free iron just sitting around, lots of organisms would say, perfect, building blocks, let's take over. So that would be a real problem.
So does the ferritin kind of store that excess iron?
Yes. So all the iron,
Yeah, okay.
the ferritin stores all your iron. It actually binds to it and holds on to that. And then there's a specific reaction that has to happen to release it. So your cell has to go through a chemical process of releasing it. And it wants to release just enough iron to make use of it and not release any more than that. Because if you release too much, then you have free iron. And that, like I said, that's dangerous to the body. And it makes it possible for microorganisms to take over.
And does it release the iron in order to facilitate oxygen transport mainly? Or does it support other bodily systems that utilize iron?
No, it releases it because there's going to be other bodily processes. You need iron to make things.
So hemoglobin has the job of transporting oxygen and releasing oxygen when needed.
Exactly.
And ferritin has a different job with regards to iron and other processes in the body that use iron.
Right. So
Okay.
one of the real relationship here is that ferritin, iron is used as an essential mineral for several things, but it also creates the hemoglobin. That's how you make hemoglobin. So whenever you're making hemoglobin or red blood cells in the bone marrow, you release this iron. So you have to have this tight control over the iron. The ferritin holds on to that iron, and then it releases it so you can, for example, make hemoglobin. A couple of other, yeah. So, but also like muscle and organ function, brain health. It helps, for example, you use iron to help create neurotransmitters such as dopamine and serotonin. Obviously, you need it in healthy skin, hair, and nails. It's necessary for producing collagen. right? So we use iron for a lot of things. And again, we have to keep very tight control of it because it's very damaging to the body in a free form. So it really has to be one of those things that the ferritin holds on to that iron and then releases it just in small bits so that the other all the other cellular processes can take it up and use it before it has a chance to do damage to the cell or to the body if it got outside the cell.
And I think you're going to talk about how the body signals to do that later in this podcast. Is that right? Okay.
That is true.
All right. Stay tuned.
Don't
go away.
Okay. So as we said, common signs of low ferritin: fatigue, reduced endurance, shortness of breath, hair loss or brittle nails, again, which is part of that whole thing. So this often shows for athletes, this often shows up as, I just don't feel like myself, or I just can't compete. I'm not that competitor that I normally am. So then on to transferrin, your iron transport system. So if ferritin is storage, transferrin is the delivery system. It moves iron through the bloodstream to muscles, bone marrow, and organs. Obviously, you're going to make various things there. And you have, for example, muscle cells, bone marrow, you're going to make red blood cells. Organs, you're going to, you're going to go through various processes, glandular processes of making hormones, etc. So one of the things we often look at is the transferrin saturation and how much of that transport system is actually loaded with iron, right? So we want to know how much iron stores do you have, and how good are you at moving those iron stores? Those are two numbers that we want to have to tell us about how well are you controlling your iron stores, and how good of a production facility do you have, or is your supply chain thrown off?
Sorry, I just wanted to interrupt.
No, yeah.
Is there a way? So transferrin, I guess, is another kind of protein.
It is.
And then, yeah. And you can measure how much iron it contains, and that would tell you how saturated it is.
Yeah, exactly. You can do a measurement. Just another blood test that will tell you, here's what your transferrin is, and then of course how reactive it is. And so it's somewhat of a glycoprotein is what they call it. It's produced by the liver that binds, transports, and distributes iron throughout the body, trying to maintain homeostasis. So again, another thing that the liver's in charge of. So as we're looking at that, so we actually want to know, like, as we measure that, we're measuring it to see, does the transport system actually work? Do you have transferrin, and does it have iron in it? Very important things to know. So if it's too high, the body is trying to capture more iron, right? If your transferrin levels are really high, it's because your body's trying to capture more iron. It needs iron. In other words, you're iron deficient. Often seen with iron deficiency, right? So if we saw that really high transferrin levels, we'd go, oh, you just don't have enough iron. And that's when you advise somebody like, well, iron supplementation is nice. I oftentimes, when you see somebody with particularly high transferrin and they're having these problems, I often suggest that they go that they hang a bag of iron and get an injection of iron to get their stores up right away. Doctors a lot of times will say, hey, let's take the slow road and let's do this through supplementation. Let's see. But I don't like to wait that long, because normally by the time the person's gotten to me and we've recognized the problem,
they're pretty bad off.
They're pretty bad off. Yeah, we're having.
Yeah.
So you can do an iron injection. You can do just like intramuscularly. You can do an iron infusion used to quickly replenish iron stores when oral supplements are ineffective or poorly tolerated. That's one thing, is again, how well does this patient absorb iron, right? So we have to look at absorptive processes, this, that, the other. And so there's already, in people who have gut inflammation, anybody who has a digestive issue is going to have gut inflammation, and that gut inflammation means that they can't absorb the iron and hold on to it. So that's another reason that I suggest getting a shot or an infusion of iron so that it happens now, and we bypass that whole gastrointestinal system and don't have to wait around. Because to me, especially when it's an athlete, it's like, look, you've already proven that you're not absorbing iron, because there's lots of iron in all sorts of stuff. Especially with people, for the most part, having fairly good nutrition. Certainly you could tell people, better nutrition, supplementation is a help. But if you're already too low and having too many problems, it's oftentimes a good idea to at least get an iron infusion to start with, and then make sure that you're doing your supplementation after that.
It makes a huge difference.
Does it?
Get
Have
in
you
there
had a
quick, and then yeah, recently had some that we were messing with it and stuff, and finally she went and got an infusion, and we're like, okay, you got hit hard enough that now it gives us puts the system on a little bit of, reprieve, so we can get in and make some changes and help the gut better absorb things later. But sometimes you're
right?
like, you got to hit it hard and just get get that out of the way because it's just in a downward spiral pretty quick.
Right, exactly. I mean, and especially menstruating females. It's like, look, let's not screw around. You already have blood loss on a regular basis. Let's just get your levels up. And I've seen people do it through a supplementation, but it can just take a really long time. And unfortunately, a lot of times what happens is, of course, the doctor's like, well, go eat a steak on a regular basis. And some of these patients are vegetarian or vegan. And you're like, well, that's not happening.
Not
So
happening.
not happening. And again, gut inflammation is going to really slow this down. So it's like, well, a good Kickstarter. Now, of course, always talk to your physician about this. Or in
Hmm.
naturopaths offices often offer these services. There's a lot of rejuvenation clinics around that do this. So there's a lot of availability out there. So now, why this matters so much for athletes, though, is because athletes place higher demands on their system. They have increased red blood cell turnover, right? They're constantly bruising themselves, beating up blood cells from impact and heavy load, exercise load. They have higher oxygen demand, sweat losses, right? So they're losing a lot of sweat, a lot of electrolytes. Uh, they have foot strike hemolysis, especially runners, right? In other words, they're breaking red blood cells every time they hit the ground because they're pounding the ground. And uh, you would think, well, sprinters are really going to have that, right? But a long distance person, they might not break as many red blood cells on every step, but they take a lot more steps. So something that they might not be aware of. And then just general inflammation from training, right? That there's generalized inflammation. There's a higher load on the body. So even in these cases, even mild deficiencies can cause significant performance decline. And like I have some paid athletes that I treat, and you're like, yeah, this we don't have time to mess around, and you really can't. You don't want to mess around with this. So, and I guess the bottom line is you don't need to be anemic to be limited. Low ferritin alone can reduce your VO2 max, impair mitochondrial function, and decrease endurance, right? Through the loss of mitochondrial function. And you don't want to put extra stress on your mitochondria. You want to give them everything they need. So, something that people need to be aware of, and to make sure that you're not just doing the, oh, well, you have your hemoglobin, you're good. It's like, uh, you might be stealing from Peter to pay Paul there, that you have that, but you're not feeding your mitochondria. You're not feeding those other good glandular processes. You're not, and, or do you have the beginnings of anemia, but you just can't quite see it? Let's act now is often my motto.
Yes.
Okay. So, and then the hidden layer, right? Inflammation. So here's where it gets a little more complex. Ferritin is also an inflammatory marker. So ferritin can be low, and that's a true deficiency, but it can be normal or high, but iron is still unavailable. And you ask yourself, well, how could that be? Because inflammation can kind of trap the iron in storage. The iron won't be able to get out of storage, right? It'll be stuck in the ferritin. So you have plenty of, like, hey, looks good. My ferritin numbers are normal or high. But then your transferrin can't access it, cause a chemical process. Remember, these are chemical processes, and they need the right kind of uh, the right conditions to properly function. And if you have too much inflammation, that really blocks a lot of processes in the human body. And transferrin, the function of transferrin is one of them. So this creates a mismatch between, iron is present but not usable, and often seen in chronic stress, overtraining, particularly illness. Certainly, so one of the things is that early on in an illness, particularly bacterial infection, patients dump their iron stores to make them unavailable to the bacteria. But then, because of the inflammation and all the other things going on in the body, then the iron stores they do still have are not necessarily available to be used again. So then they have this now chronically low uh, iron level, and poor recovery from exercise, poor recovery from life's challenges, etc. So we see that a lot. So the patient technically has iron, but it's just not usable. Um, uh, one of our good friends, Dennis Eaton, was always on hard about transferrin. If we had him here today, he'd go on
Oh,
and on
yes.
about it. So hopefully Dennis isn't listening just yet. But um, he'll be like, dang it, you should have said this, you should have said that. I'm like, should have had you on. Maybe we'll have him come on and we'll talk more about it. We have a few of these to cover. Okay,
But
so
definitely
here's
helped clue us into like underscoring the importance of it and paying attention for sure.
Totally. He was really onto that. So it was good to know that and go, oh, we got to look at this. Okay, so here's the osteopathic perspective. This is where we kind of zoom out, and instead of asking like, is the iron low, we ask, is the system able to deliver and use iron effectively, right? So just the simple ask of, oh, is the iron low? Well, no, the iron's not low. Oh, okay, everything's fine. That may not be the full answer. The full answer is going to be, are we able to deliver it and use it effectively? So in this situation, circulation matters. Iron delivery depends on blood flow, oxygen exchange, tissue perfusion. Can you say diaphragm and mobility, whole body mobility? If movement is restricted, the rib cage, the diaphragm, the thoracic spine, those will all alter oxygen delivery and utilization adversely, right? Those are all things, and those are all things that as osteopathic manual therapists, we all focus on. Pretty much every treatment, those three areas are going to be touched, right? Which is important. And then even back to red blood cells are made in the bone marrow and of the long bones, right? And oftentimes you'll ask people in class like, oh, what are the long bones? And everyone wants to say the humerus or the femur. And while those are long bones, you have far greater amounts of red blood cell production in the rib cage, in the ribs, than you do any of those other bones. Those other bones actually start to fill up with fat at the top and bottom and stop their bone marrow production or usage. So, especially as people have injuries, like you've broken your ankle or you injured this or injured that, you make the bone rigid and then it fills in with fat. So it won't do that turnover of bone marrow making red blood cells. Again, making the rib cage and the thoracic spine even more important. Okay, so the diaphragm and energy. The diaphragm influences oxygen intake, obviously, venous return. It helps drive venous return, and lymphatic flow. So the diaphragm, you only breathe 23 to 32,000 times a day. And so poor breathing mechanics will highly reduce the efficiency of oxygen and nutrient delivery because that diaphragm really helps force circulation. Obviously, arterial perfusion is driven by the heart. After that, it's a much lower level system. It's a lower pressure system after that. And lymphatic return is really low in comparison. Now, the gut connection. Iron absorption happens in the digestive system. So as we were just talking about, gut inflammation, poor motility, if patients don't move, like for example, people who have gastric, lack of gastric motility, they're just, they won't move food through their stomach in time to really absorb properly. And so they just won't get good absorption. And so obviously one of the factors in poor motility of the gut is stress, right? So the sympathetics are constantly turning down the gut, and then you get localized inflammation, which again, iron transport becomes very difficult in inflammatory processes, partially because the inflammatory processes react with the iron. And now it becomes a different chemical, it becomes part of a different chemical. And now that chemical is harder to break down. And then this will all reduce the iron uptake. And then, of course, what will happen is that that iron will just be excreted in these other forms, and it won't be uptaken by the intestinal tract, just as we were talking about. So nervous system load. Chronic stress shifts the body into higher sympathetic tone, reduced recovery, altered hormone balance. These things all affect iron metabolism, inflammation, and performance. And just as we're talking about, that's all part of this whole system or circle of function that we're talking about absorption and sympathetic tone, inflammation, and how that affects athletic performance. The nervous system load, too much stress, too much chronic stress, not enough rest, not enough recovery. Those things all really throw us off and throw our system off. And so you have to have times of recovery. And this is one of the reasons we talk to patients about, you have to take, every day is a good idea to take a 20-minute, some period of time to yourself, whether that's a meditation, whether that's a soak in the tub, whether that's actually, I was listening to Huberman podcast, and he's really on about being in the sauna for 20 minutes. And they've shown really high increases in about a 16% increase in human growth hormone after spending 20 minutes in a sauna above a certain temperature, which is, and then that's if you do it once a week. If you're doing it daily, it starts off at like 16%, and then it's about 4% every day increase in human growth hormone. And his conclusion was, well, then just do it once a week so you get that real big surge. And my conclusion would be like, it'd be better for you to do that every day. And that's often what we tell patients about. Like, you need 20 minutes every day to be alone. So if you have the means or the funds or the access, a sauna is a great place to do that, because not only will you change this nervous system load, but what you'll do is you'll actually get a huge burst of human growth hormone, which will take care of a lot of these other things. That helps heal the gut, helps with a lot of these other processes we're talking about. So something to think about. Okay, so instead of thinking about all this in lab values, right? Because we can get stuck on numbers and this, that, the other, and everybody wants to overanalyze numbers. Let's go to a simpler model. Think in these three questions. Do you have enough iron? Can it move? Can you move it where it needs to go? In other words, do you have enough iron? Do you have ferritin? Can you move it where it needs to go? Do you have transferrin function? And then can your body actually use it? Systemic function, which is what we were just kind of talking about. Do you have the ability to absorb? Do you have the ability to utilize it? Do you have the neuroendocrine axis function to make use of the iron that you do have? And if any one of those breaks down, performance drops, recovery slows, symptoms appear. So when people are walking in the door, we as osteopathic manual therapists are always considering that neuroendocrine axis and understanding how it functions and how it relies on something as simple as iron stores, ability to transfer iron, and an ability to get it to where it needs to go and make use of it. That neuroendocrine axis just doesn't function properly without it. So our practical takeaways, really, for patients and athletes, as we've already hinted at some of these, but so pay attention to unexplained fatigue, plateaus in training, poor recovery, declining performance. Those are indicators. Those are early indicators that there's a problem going on. And I'm not saying that every one of those is always ferritin, transferrin levels, but it's one of the very first things you want to look at. And then, of course, we want to look at and it's not that we don't want to do the lab tests. We do want to do the lab tests. We have to do all the lab tests, measure both of those numbers, not just hemoglobin, not just red blood cells, but also measure that ferritin, transferrin. So the labs that really matter is ferritin levels, transferrin, and transferrin saturation, and of course hemoglobin. But again, everybody wants to rely on that number alone to tell us, oh, no, you're fine, you don't have anemia. There's far more to anemia, quote unquote, than just hemoglobin numbers. Clinically, if we see a low ferritin, we know they have a low reserve of iron. If we see low saturation, we know they have poor delivery of iron. But if they have normal ferritin plus symptoms, consider inflammation as the source. And then what do we do about inflammation? Well, first off, you go and look for it. Oftentimes you can find out where it is. And is that inflammation due to neuroendocrine disruption? Is that due to, like, say, kidney breakdown? So consider inflammation. Is that inflammation? Is that a breakdown in the neuroendocrine system? Is that a gut inflammation problem? Is that early renal disease? That's certainly something that, as we all age, we have to keep an eye on. It's a huge problem, and most humans don't necessarily recognize your kidneys are what keeps so much of you going. So specifically, let's talk about the example of in older people that one day this older person's doing fine, and then the next day the doctor or a family member is saying, oh my gosh, I think they have Alzheimer's. They've completely lost their mind. And of course, most clinicians are going to know to say, hold on, let's check them for a urinary tract infection. If they have a urinary tract infection and they have inflammation in their genitourinary tract, then the kidneys stop being able to control electrolyte balance. Well, if the kidneys lose electrolyte balance control, then the brain stops functioning properly, right? Well, one of the reasons that they might have that is something to do with their iron. If they don't have tight control of their iron, they don't have the storage, they don't have the control, and either bacteria have gotten a hold of that, or they just don't have good control of it. So they have more inflammation, and that inflammation sets them up for being infected. That often happens where a patient has a challenge in an area, whether that was a viral infection, whether it was an injury, and then they get a subsequent bacterial infection just because their immune system in that area kind of fell down on the job because it was overwhelmed. That happens quite a bit. And so we really have to understand, where is that inflammation? Is it in the kidneys? Is it in the gut? Is it because of the neuroendocrine system? Is it because of an injury, or is it because of a chronic re-injury or a chronic injury that we would call overtraining or poor ergonomics at work. So that they're constantly putting stress on their system such that they have chronic inflammation. So you can see that it's that we have a lot of these patients and they're sitting here complaining about things and we're going, gosh, I just don't understand why I'm not getting this patient better. I must be falling down on my job somehow. I'm not doing what I need to do. When really, they've been to their doctor and they've had their blood test, but the doctor only looked at the hemoglobin levels and the red blood cells and said, everything looks fine on this end. And that's not enough. We need ferritin levels, transferrin levels, transferrin saturation. We have to have those numbers to really have an idea of what's going on and to follow that up and figure out where and why and how. And you alluded to it earlier that you often get your patients say, hey, look, why don't you go get an iron infusion now, and we'll work on your gut inflammation or women, particularly with menstruation and the inflammatory, like pelvic inflammatory disease of what we call endometriosis, fibroids, ovarian cysts, anybody who's diabetic or pre-diabetic, anybody's peri-diabetic, as we should call it. Those are all inflammatory states. Thyroid problems, inflammatory states, whether that's hypo or hyper, as we've talked about in previous podcasts here, those are inflammatory states, and they're going to undermine the body's control of iron and the ability to transport it and get it to the site where it needs to be used.
Yeah. I see that. I'm noticing in my patients, I think you are too, and you tell us that too. Like, we'll never underestimate the fact that they could have something underlying and then have an injury that just sets it off, right? So if you only treat the injury or you only look for one, the answer could be yes, like you always tell us, right? It could be
Right.
both, and just the onset, like some event like tipped it over the edge, but you still have that underlying thing there. And when I treat patients, whether it's overt pathology or whether it's just not behaving, all those areas that you talked about, the ribs are going to be stiff, the kidneys are going to have congestion around them, the gut's going to be inflamed, and so whether it's overt or not, we still are useful because maybe it's something we can fix totally, but they're usually going to need some kind of support on either end. So that's going to help.
Yeah, exactly. So what do we do, right? As osteopathic manual therapists, or just as any healthcare person? Well, we obviously talk to people, about nutrition. There's plenty of information out there about nutrition. Get your green leafy vegetables, get your iron here, get your iron there. But also talking to them about recovery, finding out like what kind of recovery, how do you know what recovery is? Whether that's heart rate variability, whether that's some specific other number that they're looking at. A lot of people have apps on their phones that they can use to tell them, am I overtrained or undertrained? Talking about sleep and sleep quality, right? People can get plenty of sleep and have poor sleep quality, and that's going to set off these problems. And then what goes hand in hand with that is stress management. How are they handling their stress? Are they getting those 15 to 20 minutes to themselves to clear their mind and just relax, or to laugh, or to something to get them out of the chronic situation they're in and have a chance to enjoy their life and have perspective on their life? That will really help them manage their stress. And then finally, the biggest thing that we can do is movement quality, making sure that the mid-back, the thoracic spine, the rib cage, the diaphragm, the hamstrings, the hips, the head and neck, the shoulders, does this whole body move, and can you move into different positions and still get oxygen in and still drive fluid to your body, which helps drive out inflammation and keeps you healthy. So those are huge ones for us.
Yep. And one thing that I would add for anybody that might be listening, especially if you're like, I might feel like that, but I'm so young, right? With all the stress that people are under, and that's kind of just a known, we just know, right? It's happening earlier and earlier. So, I mean, you don't have to be super old to be, in your late, retirement age, or, we don't have to be in perimenopause to be having this. It could be you're not recovering from having a baby and you're 25 years old, it's just depending on how much stress and it's not, I feel stressed all the time. It's how many balls am I juggling? It doesn't matter if you're brought down by it, how you feel about it, but you have a lot going on. Well, then it could be, and it's something you should check out for sure.
Yeah, it could be positive stress. Hey, we just bought a new house and I got a raise and I got a new job, and like I got a promotion at work. Awesome. Like, yeah, that's awesome. Yeah, great. More work. And yeah, so there could be good stressors as well, right?
Mm-hmm.
Yeah, so manual therapy specifically, we can support circulation, making sure that there's decreased resistance to flow, making sure that the kidneys can function like they should, improve breathing, help people's recovery capacity. Can they recover more quickly? Are they able to process their fluids? So those are all really important things. And so I just we're going to do a whole series on this ferritin, transferrin. We're going to go here and there, and we're going to talk about different aspects of it. But this is really a great overview of like, okay, so let's get into this and start talking about these topics and understanding the baseline of what it is that's going on. And then we're going to work off of this in various different directions. That'll be fascinating and hopefully helpful to patients and therapists alike. So, okay, so as we wrap up today's discussion, it's worth remembering that the body is not simply a collection of parts. It is a dynamic signaling system. Health emerges when the body's major regulatory networks, biomechanical, bioelectrical, and biochemical, communicate effectively. When those signals become distorted or restricted, physiology begins to drift from thriving to surviving and eventually towards failure to thrive. The purpose of osteopathic manual therapy is not to replace medicine or eliminate disease on its own. Instead, its role is to restore adaptability, to improve motion, circulation, neural regulation, and the body's ability to respond appropriately to internal and external stress. When those fundamental signals are restored, the body often regains its capacity to regulate itself. That's the central idea behind OsteoSignal, understanding the signals that govern physiology and using that knowledge to help patients move towards greater health. Thank you for listening to the OsteoSignal podcast. I'm Neil O'Neill, here with Autumn Mayberry and Brent Mayberry. And until next time, keep paying attention to the signals.
All right. Thank you, Neil. Hey, I just wanted
Thanks,
to say
Neil.
that if any of this information was interesting or helpful to you, please like our podcast, subscribe. We're on Spotify, Apple Podcasts. Give us a rating on Apple Podcasts. We're on YouTube and Rumble. And so, that support goes a long way to letting us know that what we're doing is helpful and valuable, not only to you, but to anybody you may want to share this with. And so we encourage you to do that and help us out. Thanks so much.
All right. Thanks a lot.
All right. Thanks, Neil.
Thanks.
Thanks for joining us on another episode of OsteoSignal with Neil D. O'Neill. For more information, please visit PursuitPT.com or PursuitPerformanceTraining.com. Want to show your support for the podcast? Give us a like, click subscribe, and leave a comment or review. We appreciate it. Our music was written and performed by Sky Toes. Copyright 2026 by Neil D. O'Neill.